Dear Doctor, I'm addressing you today with a message I believe is critically important for the well-being of your patients. This isn't just another video. It concerns a significant issue that may be affecting many individuals under your care: withdrawal from psychiatric medications taken as prescribed. I urge you to take the time to listen carefully, as the information I'm about to share could significantly improve patient outcomes and potentially prevent unnecessary suffering. I understand that you've dedicated years to your medical training, and I approach this conversation with the utmost respect for your expertise. However, I also recognize that some aspects of managing long-term psychiatric medication use and withdrawal, unfortunately, aren't always covered as comprehensively as they could be in medical education. My goal here isn't to challenge your knowledge, but to offer a complementary perspective based on my lived experience, as well as others, and extensive research, a perspective that I believe can enhance your understanding and ultimately benefit your patients. My name is Guy Rothenberg. I'm not a physician, but I am someone with extensive lived experience navigating complexities of withdrawal from psychiatric medications, including benzodiazepines and antidepressants. I understand that you are a busy professional dedicated to your patients' well-being. I also understand that many of you may have limited exposure to the realities of long-term use of these medications and the challenges of discontinuation. That's why I'm here today, to share my experience and bridge a potential gap in understanding. My goal isn't to criticize or blame. Instead, I want to offer a collaborative approach, one that combines your medical expertise with our lived experience to improve patient outcomes. I've learned, often the hard way, that successful discontinuation of many psychiatric medications require a very specific approach. While the specific may vary depending on the medication, some key principles apply. Benzodiazepine dependence can develop surprisingly quickly, sometimes even within days of regular use, while in others it may take weeks, months, or even years. For some lucky individuals, dependence, tolerance, or serious withdrawal doesn't occur even after years of use, but for the vast majority, this is not the case. For me, it was only 28 days before I tried to cut my clonazepam dosage in half, resulting in my mental and physical health to shatter. This means that it is never safe to abruptly stop taking benzodiazepine, going cold turkey, regardless of how long someone has been taking them, even if it's just been a week or two. The risk of serious withdrawal symptoms is always present. It is crucial to emphasize that abruptly stopping any of these medications, be it antidepressants, antipsychotics, or other psychiatric drugs, taken for more than a week or two, is extremely dangerous and even life-threatening, particularly with benzodiazepines. It's vital to continue providing these medications to dependent individuals while carefully managing their dosage and working towards a slow, safe taper, recognizing that these patients are not addicts in the typical sense, but individuals who have developed a physiological dependence on prescribed medication. For benzodiazepines and other similar medications, guidelines like the NICE guidelines of 2018 advocate for geometric or exponential tapering. A geometric taper, where each dose reduction is a percentage of the previous dose, typically between 1% and 10%, is crucial. This might seem counterintuitive, but research actually shows that this percentage-based reduction translates to a linear effect on the brain. This naturally adjusts the dose decreases, providing a smooth, more manageable transition for the brain. Conversely, attempting a linear reduction, say cutting the dose by a fixed amount of milligrams each time, actually becomes exponentially harder on the brain as the dose gets lower. The smaller the dose, the more significant each milligram reduction becomes, leading to increased withdrawal symptoms. To ensure the accuracy of these small dose adjustments, I personally use a cheap but precise jeweler scale that measures in milligrams. This eliminates the guesswork and potential inconsistencies of splitting pills into halves or quarters, which can be particularly crucial at lower doses. Available research for antidepressant tapering is the Most Prescribing Guidelines. While I've reviewed some of the issues in that book on my channel, it does confirm, through research, the fundamental principle that tapering should occur along a curve, what they refer to there as hyperbolic tapering. It's an excellent resource for gaining knowledge on the subject, and I highly recommend reading it. However, when it comes to the practical application of tapering, the example tables in the multi-guidelines, like many other resources, fall short. They don't use a precise cutting tool like a jewel scale. This is a critical shortcoming, especially for patients who are highly sensitive to dose changes. Inaccurate adjustments can cause severe side effects. They don't utilize a dynamic, scalable tool like the online tapering tool I've developed. And a precise, individualized approach is essential. Furthermore, the multi-guidelines, like many other resources, often dismiss the potential role of supplements during withdrawal and even put a blank warning on any or all of them. This, at least anecdotally, is not only untrue, but potentially harmful. While it's true that each patient is different, and some may react to even seemingly benign supplements like magnesium or certain B vitamins, many individuals are actually deficient in those nutrients. I can tell you from my own lived experience that CBD oil from a specific Australian brand, Agmatine, NAC, as well as Stabilium, which my psychiatric mom used for decades as a safer alternative to SSRIs and as a tool to help people successfully taper off SSRIs, helped me tremendously during second half of my clonazepam taper, to the point of having almost no side effects. I encourage you to explore my videos for more detailed information on the specific supplements that have been very helpful for me. It's important to remember that a holistic approach, considering all aspects of the patient's health, is crucial. And if there are any researchers watching this video, I would be very willing to cooperate and explore effects of these supplements in the proper peer-reviewed study. I believe that rigorous scientific investigation is essential to fully understand their potential role in supporting patients during withdrawal. To assist with this process, I've created a free, easy-to-use tapering tool in Google Sheets. While I originally designed it for my own taper from benzodiazepines, the underlying principles of percentage-based reduction can be adapted to any other medication in the psychiatric realm as well. It allows both doctor and patient to track progress, record notes about each reduction, and automatically calculate the next dose based on the chosen percentage, which can change. This allows transparency and can empower the patient and strengthen the doctor-patient relationship. I understand the pressure to quickly manage patient medications. However, rushing the discontinuation of any psychiatric medication can be counterproductive, leading to increased withdrawal, suffering, and potentially even protracted withdrawal, which can last years. My work now focuses on educating both patients and doctors about this process and providing peer support to those navigating this challenging journey. And I want to emphasize the value of that lived experience. While in withdrawal, I dedicated countless hours, sometimes 12 hours or more a day, to research withdrawals from psychiatric medications simply because my life depended on it. I also connected with and learned from countless other individuals, both patients and professionals, who are deeply involved in this field. I understand what your patients are going through, the diverse range of physical and psychological symptoms that can arise and can be unbearable. I can be the crisis contact, be a listening ear, and give them practical advice when they need it most. As a peer support worker, my role is to work directly and positively with you, the doctor. I am not here to replace your expertise, but to complement it with my unique understanding of the patient's experience. There are many things that personally helped me in this journey, and I'm always open to explore other helpful approaches. The key is holistic treatment, one that considers the patient's entire life, their family, finances, and other physical and mental health challenges they may be facing and you are aware of. By working together, we can provide truly comprehensive and compassionate care. I invite you to explore the tapering tool, consider the principles of gradual reduction, and engage in open communication with your patients about the individual needs. Let's work together to provide compassionate and effective care. If you have any questions or would like to engage in further conversation about this topic or any other, please don't hesitate to contact me at guyrothenberg01@gmail.com. I'm always open to discuss those issues and collaborate with healthcare professionals to improve patients' care. Thank you so much for watching, and I hope to be in touch with you soon.